Welcome to this month's Policy Pulse. Today, we're talking about wound care, what a wound is, how to spot one, and the right way to record and escalate concerns. What is a wound? A wound is any break in the skin. Wounds can be superficial or complex, open or closed. They can happen to anyone and may cause pain or discomfort. They also increase the risk of infection and, in severe cases, sepsis. That's why early identification and proper management is so important. How to observe a wound. When assisting residents with personal care or responding to an incident, we should always do the following. Look for early signs of skin breakdown. This includes redness, swelling, blisters, scratches, grazes, or broken skin injuries. We should check dressings for any leaks, odors, or increased pain around the area. We should observe the skin during daily routines. This includes washing, dressing, and also toileting. Body maps are an essential part of wound care. We should always complete a body map on admission to establish a baseline for each resident. The body map should be updated if any new wounds or skin issues appear. We should also complete a body map at the point of discharge to record the resident's skin condition on leaving the service. If you spot anything unusual, body map it, photograph it, and document it immediately. You should always explain to the resident why we are taking photos and ensure dignity is maintained at all times. Recording on PCS and documentation. All wounds must be recorded in our PCS system. Here is a step-by-step guide of how this can be done. Firstly, select the resident you want to record the wound for. Secondly, under the medical section of the person's records, you should open the wound care record and select Add New Record to complete the body map. Ensure it is completed accurately and with additional details, for example the type, location, size, and condition of the wound. Moving forward on wound care reviews, you should update dressings, reviews, and any changes you have noted in progress notes. To ensure good triangulation, the resident's skin integrity care plan must also be updated following any new wounds being documented or any changes, and the wound care record should be linked to the care plan. Remember, documentation is not just a tick box. It helps us track healing, monitor infection risk, and provide safe care for our residents. Escalation. Once a wound is identified, you must immediately report it to your care team leader, the deputy manager, the home manager, or the registered nurse on duty. For non-nursing residents, we should then escalate it to the district nursing team. They will be responsible for clinically assessing the wound and implementing a plan of care. We should always report any changes or concerns immediately to the district nurses or the GP. For example, if the wound is complex, not healing, or shows signs of infection. Any diabetic foot wounds or pressure ulcers require urgent attention. Your role is crucial in acting quickly and ensuring professional assessment. Risk assessment and infection control. It is important to remember that when it comes to wounds, as with most things in healthcare, prevention is key. As a service, we must conduct a risk assessment using the Waterloo tool on the PCS system. Care staff should follow repositioning schedules and use pressure-relieving equipment appropriate for the resident. We should also keep skin clean, dry, and moistured. Staff should always encourage hydration and good nutrition to support the healing process. We should also follow strict infection prevention measures, including hand hygiene and PPE usage. By taking these steps, we reduce the risk of infection and promote faster healing. Signs of infection. Some wounds may become infected. It's important to spot infection early so that residents get the right care and treatment, and so that we can ensure swift escalation to medical professionals. Some of the main signs to look out for include increased redness or swelling around the wound, warmth or tenderness when you touch the area, foul odor or unusual discharge from the wound, increased pain that doesn't match the usual discomfort, delayed healing or wound edges looking unhealthy, fever or general unwell feeling in the resident may also indicate infection. If you notice any of these signs, you must record it on PCS and report it to the care team leader or registered nurse immediately. They will then escalate it to the GP, the district nurse, or emergency services if needed. Early intervention can prevent serious complications like sepsis. Why wound care matters. Remember that wound care isn't just about dressings and documentation, it's about the person. Explain what you're doing. Listen to concerns. Involve residents in decisions wherever possible. Some may prefer certain times for dressing changes or may have anxieties about treatment. Taking those preferences into account supports dignity and trust. When we combine clinical best practice with compassionate, person-centered care, outcomes improve, and residents feel safe and respected. So to recap, spot concerns early, record accurately, escalate appropriately, and always prioritize prevention and infection control. Thanks for watching this month's Policy Pulse. And, as always, thank you for the important role you play in protecting our residents' health and well-being.